Do you ever wake up with your hands tingling like pins and needles? Or you feel your fingers go numb for no clear reason? It might seem like just poor circulation, but it could be your nerves trying to tell you something important. I am Dr. Andrea Furlan, a pain physician, and today we're going to talk about what causes numbness and tingling in the hands and when you should see a doctor. Nerve causes. Let's start with the most common reason, nerve problems. One of the biggest culprits, carpal tunnel syndrome. That's when a nerve in your wrist, called the median nerve, gets pinched. It often causes numbness in the thumb, index, and middle finger, and part of the ring finger. I have a full video just about carpal tunnel syndrome. Watch it here. Next, there is a ulnar nerve compression, often felt in the ring and pinky fingers. This can happen at the elbow, what we call cubital tunnel syndrome, or lower here in the wrist. This is my video about ulnar neuropathy. Another cause is a pinched nerve in the neck, also known as cervical radiculopathy. If you have neck pain and numbness that travels down your arm to your hand, this might be the reason. I have a video that I explain all you need to know about cervical radiculopathy. And then there is thoracic outlet syndrome, less common, but it's caused by compression of the nerves or the blood vessels between the neck and the shoulder. If multiple areas are affected or both hands, you could be dealing with peripheral neuropathy. That's damage to the small nerves in your hands or feet. It's often caused by diabetes, alcohol, vitamin deficiencies, or even some medications like chemotherapy. Check my full video about peripheral neuropathy here. Systemic conditions. Some whole body conditions can lead to nerve problems in the hands. Diabetes is the most common cause of peripheral neuropathy worldwide. Vitamin deficiencies, especially B12, can cause hand and foot tingling. Check my full video about vitamin B12 and pain here. But autoimmune diseases like lupus or rheumatoid arthritis can also damage nerves. Thyroid problems, especially hypothyroidism, and kidney disease can cause these symptoms too. Watch my video about hypothyroidism here. Infections and inflammation. Certain infections can attack your nerves. Shingles can cause tingling or pain in a specific strip of skin, even before the rash shows up. I made a video telling my own experience with shingles. You may watch it here. Lyme disease, HIV, and leprosy are rare but real. They can also damage nerves. And autoimmune conditions like multiple sclerosis or Guillain-barré syndrome can show up with numbness as an early sign. I have a video just about multiple sclerosis and pain. Watch it here. Mechanical and temporary causes. Sometimes the cause is much simpler, even temporary. Ever slept with your arm bent or under your head? That's a positional nerve compression, and the numbness usually goes away once you start moving. Repetitive motion, like typing or using vibrating tools, can lead to repetitive strain injuries. Or maybe you have a tight cast or a wristband or even a watch that is pressing on a nerve. But if your symptoms don't go away or are getting worse, it's time to take it seriously. Red flags. Here's when to get help right away. A sudden numbness or weakness on one side of your body, that could be a stroke. Go to the nearest emergency department or call an ambulance. Numbness with trouble walking or loss of bladder and bowel control, that could mean spinal cord compression. If your symptoms are spreading quickly or you're losing function, get seen fast. So tingling hands can be a temporary problem or a sign of something more serious. If it is frequent, spreading, or affecting your daily life, don't brush it off. A neurologist or a pain doctor can help you to get to the root cause. If you found this video helpful, please give it a like, subscribe for more tips on living well with chronic pain, and share it with someone who may benefit. And please remember, this video is not intended to give you medical advice. It's for educational purposes only. If there is an emergency, please go to the nearest emergency department, or call an ambulance. Thank you for watching. Goodbye.